Live from Denver 7, this is 7 News.
And coming up for you, very interesting information. Having gastric bypass surgery sometimes leads to plastic surgery. At 6:51, a plastic surgeon joins us to talk about the procedures.
All right, thank you very much. At 6:50, important health news. She was once a truck driver. That was until nearly 4 years ago when her weight reached nearly 500 pounds.
Then 10 months ago, this Aurora woman had gastric bypass, a surgery that saved her life. She has since lost 120 pounds, but there is still skin and fat that hangs down from her stomach, keeping her from walking and keeping her from going back to work. Tonight at 10 o'clock, follow Sandy Fuller as she undergoes an amazing surgery that will help her out of her wheelchair. And joining us this morning, we're very pleased to welcome Dr. John Grossman from Grossman Plastic Surgery, where Sandy went for her life-changing procedure. And while you didn't actually operate on Sandy, we're wondering if you see more and more gastric bypass patients coming in for plastic surgery and what kind of scarring they're left with.
Well, we do see many more patients, and we have a relationship with a very fine bypass bariatric surgeon, really part of a team of bariatric physician, bariatric surgeon, nutritionist, and so on. So we play a combined role with the bariatric surgeon because there is life after weight loss. But life after weight loss means having many pounds of loose skin that in many ways is almost as deforming as the excess weight, so that there are folds, many of them, of skin, aprons of skin down to one's knees, arms that hang with significant tissue, breasts that are very dependent. And so the patient really then becomes a candidate for what is really reconstructive plastic surgery to eliminate the extra tissues. And the numbers of these patients really has grown astronomically from 67,000 bypass surgeries in 2002 to perhaps 250,000 next year.
Wow, that's a
and
lot.
Each patient is a potential 6-operation plastic surgery patient.
Afterwards, tell us more about exactly what you do to fix things, if you will.
Well, among the most important pieces for these patients is what we call a lower body lift that includes a tummy tuck, and essentially we're making an incision that goes at about the waistline circumferentially around the body, and as if you were wearing a pantaloon, all this loose skin of your thighs, your buttocks, and so on, and your abdomen, we are lifting and trimming off many pounds of this tissue, lifting it up and resecuring it, so that as if you had droopy drawers, and we lifted them, trimmed off the excess, and sewed it back. And it's the same sort of thing that we do with breasts and with arms and so on, that makes life worthwhile again. And while there certainly are scars, and the scars are not small, the scars are minuscule emotionally in comparison with the obesity and the laxity. And of course, the obesity surgery is so important because it often eliminates a lot of other diseases that patients have developed from the obesity, diabetes and high blood pressure and heart disease and bed sores.
Right.
So on.
All those things. It's very fascinating. We want to invite everybody to tune in tonight for this special report. It is our 10:15 difference tonight. We are there as Sandy Fuller goes through her life-changing plastic surgery procedure where doctors remove an amazing amount of skin and fat from her abdomen. And you can see the dramatic results tonight at 10. Thank you so much for being here.
It's my pleasure.
It's very
Fascinating
fascinating
field. Changing people's lives. We appreciate your being here.